Lucky number 13, outcomes associated with preoperative weight loss after laparoscopic Roux-En-Y gastric bypass. Dr. Blackledge, are you here? There she is. Take the stage.
I want to thank SAGES for this opportunity to present our study today. And I'll be talking about outcomes associated with preoperative weight loss after laparoscopic Roux-En-Y gastric bypass. So I have no disclosures. So as part of the approval process for bariatric surgery, many insurance companies require patients to undergo a recent supervised weight loss program. So the purpose of our study was to evaluate the relationship of preoperative weight changes with outcomes following laparoscopic Roux-En-Y gastric bypass. So we performed a retrospective review of all of our adult patients undergoing laparoscopic Roux-En-Y gastric bypass between 2008 and 2012 at a single institution. Univariate and bivariate frequencies were compared using a Guy-squared or Kruskal-Wallis test, and generalized linear models were also used to examine differences in postoperative weight outcomes at 6, 12, and 24 months. So a total of 300 patients were stratified into quartiles based on the amount of percent excess weight gain and percent excess weight loss in their initial evaluation period. So there were no statistical significant differences in the demographics of the patients based on age, sex, race, and comorbidities. However, we did notice that our patients had a statistically significant difference in the time to operation. We also noticed a trend with the initial weights of our greatest gainers being lower than that of our greatest losers at the time of their initial visits. However, at their preoperative visit immediately prior to surgery, these differences essentially changed to where our greatest gainers had the highest weight and our greatest losers had the lowest weight. There were no statistical significant differences in our postoperative complications. However, we did notice that our greatest gainers had a higher number of complications than our greatest losers. Our generalized linear models, adjusted models, showed that there were no differences in postoperative percent excess weight loss at 6, 12, and 24 months. So this study suggests that preoperative weight loss requirements prior to bariatric surgery may prolong the time to surgery without significantly improving their postoperative outcomes. Thank you.
Would you suggest then that all patients go right to surgery without a trial of weight loss?
No, and I do think that patients should be encouraged to continue to undergo attempts and efforts to try to lose weight before surgery because, you know, again, it's a lot of behavior modifications. I do think the rigorous recommendations, you know, some insurance companies having patients wait for up to 6 months, you know, before they can even approve their bariatric procedure is, you know, a bit much. And so I think, you know, sometimes it can harm the patients because it's delaying their time to, you know, potential procedure. So.
That was great work. And I think 3 to 6 months is not an unreasonable time to make sure that people have the commitment to the lifestyle changes. What I will beg you to do is please put this out there in publication because we are getting denied from insurance if they've gone through that wait period and have not lost weight and they're using it as a criteria about whether or not they can have surgery in general. I wouldn't get rid of, I don't think, that 3 to 6 months, but it's delaying. They're saying, oh, they gained 1 pound during this weight loss, and now we're not going to do. So this is just another more evidence to have the insurance companies not do that. So that's great. Thank you. Please publish it.
Thank you.